the debut edition of the Inside the Rise agenda on the MIXX 88.7 FM. Inside the Rise agenda is an educating and informative program that signposts the achievements and mileage of the Arise agenda of the Akwa Ibom State Government, Pastor Umoino. On this program, we look forward to bringing you to speed with all of what has been achieved in the last 8 months of the administration. Remember that Arise being the acronym for agriculture, rural development, infrastructural development, security, and education. This program, in signposting the activities and mileage of the Umoino administration, is sponsored by the Office of the Chief Press Secretary to the Governor, Mr. Kerete Udo. Going forward, it airs on this dial every Friday, 5 to 6 p.m. My name is Samuel. It gives me great delight and pleasure having to be your host on this show. And on the show today, we will particularly be looking at the healthcare sector, and that's understanding the essence of healthcare and ensuring that every system gets towards healthcare delivery is adequately activated to deliver on all what it promises. And recall that it is quite pivotal to livelihood, and that is, we get it here every now and then. Health is wealth. Conscious, there is so little we can do as humans if our health is failing. So on this very edition, we'll be looking at what Governor Umoino is doing to keep Akwa Ibom people healthy, for the marketplace healthy, for education healthy, for all of that. And like I mentioned earlier, when we are not talking about agriculture, we should be talking about rural development, infrastructural expansion, security, and education, then perhaps economic development. And in all of this, the idea is, recall that the Arise agenda with 17 pillars, with all of its 17 pillars, bears direct inclinations, bears direct impact on the livelihood of Akwa Ibom people. So on this debut edition of Inside the Arise agenda on the MIXX 88.7 FM, we'll be looking at the healthcare sector. And joining me on this show is a consultant anesthetist with the University of Uyo Teaching Hospital. His name, Dr. Jacob Etiemana. You're welcome to the program.
Thank you. Good evening, Akwa Ibomites.
Remember, if you have need to step away from your seat and feel uncomfortable dragging it along with you, you may have to join us on this show by following and liking our page on Facebook at Inside the Arise agenda, where this is streamed live. And then I get straight to my guest. This is not also to forget that this show is one in the series of shows we have on a number of broadcast stations. And the Friday edition of Inside the Arise agenda show on the MIXX 88.7 FM is the happy hour edition of our show. So today we would also have to ensure someone smiles to somewhere good, and it's of course the happy hour period. Stick around, then I get straight to my guests, Dr. Jacob Etiemana. Okay, let's look at the much that the administration promised in the health sector, from the establishment of the medical corridor between the Ibom Specialist Hospital to the 4 Points by Sheraton. Then the same administration had also promised to scale up delivery on primary health care. So far, 8 months down the line, as a consummate medical professional, how well would you want to have us believe that that promise by the governor has been heeded?
Okay, it might interest you to know that His Excellency the Governor did not just sit down alone to have highfalutin dreams concerning the healthcare system in Akwa Ibom State. We in the medical sector, we are very proud to have him as a governor, because the Nigerian Medical Association was the first association, professional body, consulted by His Excellency when he was a candidate during the election. And he consulted us twice in his preparation for the polls, seeking our input, stakeholders meeting in the professional bodies among the health sectors, the Pharmaceutical Association, the Nigerian Nurses and Midwives, and the Nigerian Medical Association. So when we gave him the input, he did not also abandon us when he was sworn in as executive governor of Akwa Ibom State. Now, the things that he had promised during his campaign or across the 31 local government, we are aware that steps are being taken to actualize it, and some are being seen. They are ready on ground. You can go to Ibesikbo Sultan and you see the model primary healthcare center that has been built, the first of its kind. I don't know whether there is any primary healthcare center that you have a residential quarters for staff. I used to say, it's not about the building. How satisfied are the workers when it comes to delivering the healthcare system, but the healthcare services to the citizens. But you see, His Excellency is not just building structure. He's not just bringing equipment. He's also looking at the welfare of the healthcare workers. And that is a testament to a man who wants to fulfill all the promises that he has done. As for the medical corridors, the renal center, there are a lot of things that have been put in place because he wants to have a renal center where they will do renal transplant. The stakeholders have met. The contractors, people that wants to bring that to the benefit of Akwa Ibom State, have also come to talk to His Excellency. And I am proud to sit here to say that very soon medical professionals will be sent out of the state, out of the country, to get their hands and their skills equipped for the commencement of that renal transplant. And the medical corridor will be something that will service not just Akwa Ibom State, but Nigeria as a country.
And why renal centers when we still have a couple of other medical challenges? Why is the government zeroing in on renal centers?
The kidney problem is becoming one of the greatest burden in our society, and unfortunately, the only permanent treatment for a kidney problem is a transplanted kidney. Dialysis is just like a makeshift to better your lifestyle, and we've been losing a lot of our mothers, our fathers, our sons, and our daughters, to renal disease. So I feel we cannot keep losing our, population, especially the young age group that would have contributed immensely to the growth of the state, just for something that can be prevented. And for us that we have seen people outside the country in the Western world they've been having renal diseases for a long time, and they are still alive. We can replicate that in Akwa Ibom State, and His Excellency strongly believe that is possible, and his can-do spirit will make it possible.
Okay, it is the happy hour edition, so we're going to do little of the talk and little of having you feel the vibes, having you get on your knees and to attack the soles of your feet. So we won't be having it all talks. Let's also get to ease the body.
Start to hate You are knee deep in the mix on MIXX 88.7.
Welcome back.
Discover Lipton's flavorful and balanced taste. With our unique expertise, we select fine quality tea leaves from selected tea gardens around the world. Experience Lipton Yellow Label's flavorful and balanced taste in every sip. Discover Lipton's flavorful and balanced taste.
Some call it a disorder, a disability. Having a skin with two distinct colors may seem to others like the end of the world. Not me! I'm a babe, a speck, a 10 out of 10. Be unstoppable, the beautiful with lush hair. Lush hair. Be beautiful.
Every day when my children return from school, I don't recognize them. Hello, do I know you?
It's us, mommy.
But these dirty sweaty uniforms and socks, we're clean in the morning. Everything don't transform. I understand though, school is hectic. It takes energy to come home this transform. So I make sure they have some nutritious Milo at breakfast.
Your kids need nourishing energy. Give them the new and improved Milo at breakfast. It has nutrients that support energy release to help them get the most out of their day. Milo, energy to go further.
Milo.
How much the administration has achieved under the governor since May 29, 2023, when he took over the baton from the immediate past. It is necessary to, from time to time, reflect on how much the administration has attained across the different core pillars it campaigned with. So Dr. Etiemana earlier on had talked about what the state healthcare is not cheap anywhere in the world. But bringing to mind the recently concluded free medical outreach sponsored by the Akwa Ibom State Government, I want to begin with having you tell us if such should be a thing government should think of.
Well, the governor has changed the narrative about free medical services. Previously, some people might have been only interested in, making the announcement that they want to hold free medical services, bring in people who are not aware of like foreigners, who are not aware of what is plaguing us mainly in this part of the world.
Okay, of our realities.
Yes.
Okay.
But the governor, in a country plagued by the Jackpot syndrome, in which healthcare workers are leaving the country, could pull over 200 health professionals, professors, doctors, top-level, high-ranking pharmacists in the state, nurses of different subspecialties. You can name them, optometrists. And we conducted it was massive. You see the passion that these people gave in conducting the free medical service and the life that were touched. I feel it is the right step in the right direction.
Okay, you feel it is the right step in the right direction. That much thought would have. There are a few insights from that exercise, from that outreach, and particularly it seems you mentioned how much of top-ranking, top-graded medical professionals were part of it. We first would want to look at the impact of that outreach by listening to testimonies from some beneficiaries and patients in that outreach.
the cases that we are seeing within this period are really a variety of cases, just like we see in the teaching hospital. We've done a variety of cases, including hernias, operation for hernias. We've done operation for fibroids. We've done operation for breast lumps. We've done operation for lipomas, and we've done really a special case that we've not been taking on an outreach, and that is called the cystic hygroma.
So like what the governor is doing here is not cheap at all. If they tell you some of the amount they buy some of the drugs, how much each of the surgeries here are going for, none of these things are cheap. Healthcare is very expensive.
Reading.
We have a lot of crowd here. As you can see, where we are carrying out our surgical procedure, we have been able to standardize it. All the patients will have to go through the routine checks, and they will be evaluated by the surgeons themselves. They will be screened, the laboratory, hematological and chemistry wise. They will be thoroughly screened for viral infections, and they are, given the basic care as it is supposed to be. Basic preparation for the prior to surgery as it is done routinely. So we haven't had any complications so far. Yesterday, for all the surgical operations we carried out, we actually did not record any fatality. We didn't record any morbidity.
Okay, no morbidity, no fatality. The much we heard from medical professionals, medical personnel on that very outrage. We had the first person who spoke there, that was the voice of Professor Eyo Ekpe. I hope I got the name right.
Yes, you're right.
Yeah, Professor Eyo Ekpe and a number of other medical professionals on that very medical outrage. Then we would also be listening, before I get back to my guest, would also be listening to testimonials from some patients who benefited from that exercise.
I really appreciate the initiative of the governor of Akwa Ibom State, Pastor Moino, for having this outreach. I mean, I've benefited from it. Now I have a baby. I mean, I'm so happy. I'm so happy.
I feel really excited having my baby here. And the service really friendly. I mean, the services have been really good. I got the best care I could imagine so far, and I'm grateful.
Wow. Okay, there you just heard from the patients. A family took delivery of a bouncing baby boy, and then there were quite a number of surgeries. Then people in counts of thousands participated in that very exercise. So back to Dr. Jacob Etiemana, you were part of that outreach.
Yes, I was.
And if you asked to talk about the success, recorded from that outreach, juxtaposing SEM with other outreaches you've been involved in. What would you say? What would be your take?
The outreach just raised the standard of medical care with regards to medical outreaches. It may interest Akwa Ibomite to know that we had a total of 1,700 medical outpatient consultations, with all of them receiving drugs that could cater for their ailment for more than a week. We also performed about 248 surgeries, ranging from cesarean sections, hydrocelectomy, heniography, hysterectomy, which is removal of the uterus, fibroid surgeries, myomectomies, excision biopsies, and we saved a life of a man who had acute appendicitis, so we did appendicectomy. We also did 742 eye consultations with 630 eyeglasses dispensed to 630 Akwa Ibomites. We performed 102 dental procedures in that outreach that lasted for just 3 days. There was nobody that presented with any ailment that required drugs that was not given the right drug for the ailment.
Okay, so when we return from the advert break, we'll have you tell us what plans and arrangements are on ground to ensure that people who benefited from the surgeries have post-surgical care.
Balanced taste in every sip.
This is the only effect we call our motherland.
The place with the hottest mega mixes on the planet.
It is Inside the Rise Agenda on the MIXX 88.7. And my guest is Dr. Jacob Etiemana. We're talking about the healthcare system in the Governor Rumono administration. And before we went on that break, I had him in queue to tell us about post-K post-surgery care for beneficiaries of the recently concluded 3 days medical outreach organized by the Akwa Ibom State Government. Conscious of the fact that 3 days for someone isn't enough, for a patient isn't enough to recover from a surgery. So how are you people following up with those who had surgeries?
The number one thing that the organizers of the outreach got right was the involvement of home-based medical professionals cutting across the different health facilities in the state. You know, as part of our standing rule, we've been told that these patients, they've gone back to their different local government, their different units, the different wards, and the state is blessed to have primary health to listen to your complaint and forward same to the designated authorities. And also, we had made provision, the outreach had one of the largest recovery rooms. We were able to keep patients to ensure that the immediate post-op complications are being sorted out if there is, and they were also managed. Patients were given health talks on how to manage themselves, you know, following the surgery. And like one of the testimony we had, we also followed standard practice. All this were geared toward reducing the possibility of complications. And for us now, we are ready. If you have benefited from it and you have a complaint, I've been receiving calls myself from the people who, you know, from my local government, Etiemana, that came for the outreaches and they are back to Etiemana and they have complained. They got my number from our primary health center. They've been reaching out to me. This is also possible for any other Akwa Ibomite to do.
Okay, it's possible for every other Akwa Ibomite to do, but there is this talk about 3 days not being enough to take care of every medical, every body in the state that requires some medical attention. So in 3 days, how were you able to wrap up the program and have those unattended to return home?
The good news is that this is not the end of the free medical outreach. The government will announce another date and another venue for the free medical outreach, and every Akwa Ibomite will be able to benefit from it. And if there is anything that is pressing, the government have subsidized healthcare treatment in Nigeria hospital. You know, the cost of healthcare is very expensive, but Akwa Ibom charges the least in our general hospital when it comes to healthcare. Please do well to go to the general hospitals. Do well to harness the benefits that are there in our cottage hospital. We have professional consultants, specialists of different cadre, cutting across the different medical fields, there waiting to receive you.
Okay, Dr. Jacob, are you not worried that despite being hugely subsidized, the government, which at the moment is even in shortage of resources, is still looking at charitable ventures such as free medical outreaches?
Well, that's what they say. When the righteous is on the throne, the people rejoices. We have a righteous man leading us as the governor of Akwa Ibom State. So I'm not surprised. I have to rejoice. Akwa Ibomite must rejoice, because he is not thinking about himself or his immediate family. He is thinking about every single Akwa Ibomite. So congratulations to Akwa Ibomite for having His Excellency as our governor, who is thinking good of us.
Okay, still on the outreach, there is this misconception that the state government was organizing a retreat, a crusade, what tilts towards a religious meet for the 3 days. We seek to also use this platform to properly inform you that crusade was not organized by Akwa Ibom State Government. It was organized by the Christian Association of Nigeria in collaboration with Fathers in Faith for Good Governance. It was just the state government's way of It was only the state government, the medical outreach was only the state government's way of encouraging and supporting the event and ensuring that people don't just go to the hospitals, don't just go to churches to pray for health conditions, that they find the sanity, they find the serenity within them to visit hospitals as well. So that was hospital taken close enough to where spiritual activities were carried out. But a quick one, Dr. Jacob. Let's also have you talk to us about the effectiveness of that very outreach. The effectiveness of that very outreach, looking at the fact that by the second day we were already having an excessively overflown crowd out there waiting to be attended to. There is not even a number of medical professionals, you mentioned it here, that would make people think that was enough to attend to those people. And how safe was that very facility? We saw that it was a makeshift facility. How safe was it for such expansive array of surgical services?
We expected the crowd because we know that when it comes to medical care, people will respond. So the facility was structured in such a way that it can, like I said, the largest recovery room, because we knew that we are going to have a large turnover of patients. So we ensured that the structure could accommodate a large influx of patients. And it might interest you to know that there was no day of the outreach that people scheduled for surgery had their surgery postponed. The medical professionals stayed as late as 2 a.m. to perform surgeries, even up to the last patient. Medical professionals were still being recruited to join when there is a large influx of patients on our waiting list. And as at the third day, we also finished late into the early hours of Sunday morning. And we did our post-op rounds. After that, we had people who rested, they came back refreshed, and for me, I would say that it was effective. One of the major gains is that the outreach was not only beneficiary to, the beneficiary of the outreach was not just the patient, even ourselves as colleagues. People that have been away from the academic aspect of medical practice had an opportunity to be taught the modern ways of doing surgeries, to see the modern equipment that we brought also, to like the optometrists brought the modern equipment for eye checks. It was a beautiful sight. So we were learning from each other, we were improving our skills, and I'm very sure the beneficiary of these improved surgical skills are also Akwa Ibomites in our different hospitals in the state.
Okay, so while hoping that the beneficiaries are also tuned to the MIXX 88.7 FM, I hope that if you had a surgery, you will do well to stick yourself within medical advisories and not jump to your feet to dance now that we're slipping into the music break.
Big beats, fat jams, and fresh new info every day, all day. 88.7, The Mix.
I love my life, 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 I love my life. No, that we don't know when tomorrow might bring, by the future, the hours away. So me, I live my life today. Me, I live my life today. Yeah, so long me make the top, what I want to top, me have enough to say. So me, I live my life today. Me, I live my life today. So everybody else sing it out. Oh, I love distress you. Don't make no blood pressure make your life left you. Never you hurt a soul unless you have to defend yourself if them try to test you. Thank God for the life, yes. Me wake up this morning and alive, yes. Make them go and judge nobody no perfect, and Father God alone bring brightness. If you don't like them, I say go find the Lord. Me not no time for the work, I time so hard. Them not mad me not gonna sack a one or go join the mug, enjoy my life, I know. Few friends who me have were dear to me. Me not trust people, so me choose them carefully. Them are not clean, so them can't come near to me, can't compare to me. None of we don't know where tomorrow might bring, or the future the hours away. So me I live my life today. Me I live my life today. Yeah, so long me make a talk, what I want to talk, me have enough to say. So me I live my life today. Never live my life today. So everybody help me sing it out. I love my life. I love my life. I love my life. So me I live my life today. I love my life. I love my life. I love my life. So me I live my life today. Never make nobody get the best of you. Look on the person of the mirror on the dresser too. Tell yourself that you're not gonna make them pressure you. And live life to the fullest that you better do. Just believe me, know life not easy. Nothing we never born with gold spoon for feed. No be greedy, set a pace in a life and achieve it. Listen to me keen, you love me L-I-F-E until it left me. Me a go and keep a pray and a pray to Father God say holy age catch me. Me a beg your Father bless me, guide and protect me. Me every wrong move and me making on the streets correct me. None of we don't know where tomorrow might bring, or the future the hours away. So today, yeah, so long me make the talk, but I want to talk, me have enough to say. So everybody help me sing it out. I love my life. My life. My life. Today. I love my life. I love my life.
The hardest beats, right here on the Mix 88.7.
We arise and move forward together like never before. Akwa Ibom, arise.
Akwa Ibom, arise. It is your debut, the debut edition of Inside the Rise Agenda, and it gives us great pleasure that we've had to bring you this on your darling dial, the MIXX 88.7 FM. Okay. Remember I told you this is going to be the happy hour edition of our show, and that much. If you're following our page on Facebook at Inside the Rise Agenda, you may have to go on the live stream there to drop your answer to this question, and then we would contact you for your prize, just to make the weekend get better. What medical facility has the Akwa Ibom State Government under Pastor Umoino proposed to build in all 10 federal constituencies of the state? I take that again. What medical facility has the Akwa Ibom State Government under Pastor Umoino proposed to build in all 10 federal constituencies of the state? Get on our Facebook page, Inside the Rise Agenda. Get on the streaming link for this very session, and provide your answers. The first few correct answers would smile in the course of the weekend. Then remember, if you have any need, if you have any reason to phone in to talk to us of your impression about the healthcare sector in the Umoino administration, in the Umoino area, you do well to call the number 0904 4000 887. 0904 4000 887, or you call 0904 444 887. Okay. Good evening and welcome to Inside the Rise Agenda. Good evening. Your name and where you're calling from, please. Okay. Go ahead, please. Oh, sorry if you're... Okay, so my guest is Dr. Jacob. Dr. Jacob, let's look at the healthcare sector. There is the possibility, okay, we look at how much the government has in times past invested in healthcare. We recall that during COVID, Akwa Ibom State came through as one of the states that was really on ground to fight the scourge of COVID-19. And now, looking at the fact that there seems to be a report from donor organizations that we are not meeting up our targets on immunization, on immunizations and other such medical interventions. How well is the medical profession positioning to sensitize the people of Akwa Ibom State to understand they do not need to wait until they come down with certain ailments and begin to look forward to free medical care when they have the option of going preventive with immunizations?
Okay, His Excellency is very particular about the people in the rural community, because these are the people that are not having the exposure, if I may use that word, concerning the current trending illnesses and what to do. So that's why his focus is on the primary healthcare, and he wants to improve both the facility and the manpower. So in the health sector, we are going to have an increase in the manpower across different fields, and that will help a lot in making people available to educate our rural population, educate even the teeming urban population about the problems in the healthcare sector, especially the immunization, and making the immunization available to our children timely, because when there is a burden of decreased manpower, the few hands needs to give the immunization over a long period of time, and it's not going to work. His Excellency have seen, he has set up the stakeholders involved, the stakeholders in the health sector. They are working tirelessly to ease the pressure that is currently being faced when it comes to healthcare service delivery.
Okay, so looking at the health sector in Akwa Ibom State, the much the governor has done and how much he still promises to achieve, where do you see the health sector in Akwa Ibom evolve to in the post Umano era, assuming that he's able to achieve all of what he has set aside to achieve?
An enviable state from other states. Everybody, the medical tourism, I foresee the medical tourism being channeled to Akwa Ibom State. People will be leaving their country, people will be leaving their state to come to seek healthcare service in Akwa Ibom State. He has put plans in place to make that happen, and I am sure God is going to keep us alive to see it come into manifestation.
Okay, Akwa Ibom State will now be the new destination for medical tourism. That's much expected. It is inside the Rice Agenda on the MIXX 88.7 FM, and my guest, Jacob Etiemana, is a medical doctor. He is a consultant anesthetist with the University of Uyo Teaching Hospital. I hope that in the last couple of minutes we've been able to put you through what the administration of Pastor Umano is achieving in the healthcare sector. Remember, this program is sponsored by the Chief Press Secretary to the Governor, Mr. Kerete Udo. And this much, as with other editions of the program, we would be bringing you to speed with the achievements of the Umano administration. But just before it is TikTok past the times we have, let's have Dr. Etiemana give us his parting shot.